So it was an exciting session of lymphoma and myeloma abstracts, session F at Tandem. So there were many interesting abstracts. A few of them to note. We in that session we discussed Dr. Shah's CD19 CD20 CAR-T therapy in mantle cell lymphoma. This was a study that was a single center study, phase 1 run-in with a phase 2. It was a small study of 11 patients, but this dual targeting CAR-T demonstrated a response rate of about 100%. And at day 90, 92% of patients achieved a CR. So this is really exciting responses. They had a median follow-up of about 2 years, and in that 2-year follow-up, one patient had relapsed. So really promising data, though, of course, small sample size. All in terms of safety for this product, all patients had grade 1 to 2 CRS, but no grade 3 CRS or higher, and 2 patients had ICANS, and one of them had disease involvement in the CSF, so that may have correlated as well. So overall, I think this data demonstrated that dual targeting, CD19, CD20 CAR-T therapy can be very promising and effective in mantle cell lymphoma with very favorable toxicity profile. And Dr. Shah in a separate abstract session also presented data in DLBCL, which I won't get into, but this was the mantle cell that was presented in the lymphoma myeloma session that I chaired. So that was an interesting abstract. And then we had another abstract that was evaluating safety and efficacy of a new high-dose chemotherapy regimen of Panobinostat, gemcitabine, busulfan, and Melphalan with autologous stem cell transplant. And this was for patients with high risk or relapsed refractory myeloma. And they evaluated patients that were receiving Pano-GBM for both patients who would receive frontline transplant as well as transplant in the relapse setting that were for the first time, as well as a cohort that were receiving transplant for a second transplant, and found that this Pano-GBM was safe and effective in patients with high risk relapsed refractory myeloma, particularly after transplant in the frontline setting or for salvage auto transplant. And they compared the cohort with patients who were matched and did not received Melphalan, and found that there were improved sort of outcomes in this cohort compared to the matched concurrent controls. So I think that was an interesting study. There were a lot of questions raised about should we be intensifying conditioning therapy or not, and the future of the regimen is still unclear given the withdrawal of Panobinostat. So it's unclear kind of where the study would go next, but I think it was interesting results. And then in lymphoma, which is what I focus on, there was a study presented by Dr. ide-cel, large multi-center study evaluating about 950 patients with relapsed refractory Hodgkin lymphoma who received a variety of salvage therapies prior to transplant, and they evaluated outcomes of the chemo-based salvage therapy, BV-based salvage therapy, or PD-1 blockade based salvage therapy. And found that, basically patients who received PD-1 blockade-based salvage therapy had a statistically significant improvement in higher EFS and improved 2-year PFS compared to chemotherapy or BV alone or BV plus chemo. So I think this study, which was a large sample size and a robust sort of data collection, showed the efficacy improves with using PD-1 blockade and salvage therapy. There was no data on safety, so that there is thought that you incorporating PD-1 blockade into salvage regimens can increase the risk of engraftment syndrome. That was not looked at, but I think in terms of efficacy, we've now seen several studies that have really highlighted the use of PD-1 blockade on the salvage therapy in the salvage regimen prior to transplant can really improve outcomes post-transplant, and also even in multiply relapsed patients. So I think that kind of highlighted that concept again that we've seen, and the common PD-1 based blockade therapies that we now use in combination with chemo tends to be either pembro plus GVD or nivo plus ICE. So those are sort of, I think, very good salvage regimens to consider for prior to transplant. So I think that was an important abstract that was presented. And then there was another abstract in a session that was in myeloma. It was Dr. Surbi Sidana presented the safety and efficacy of ide-cel in relapsed refractory myeloma patients with renal impairment. And this is a particularly important question because these patients are high risk And we often see myeloma, these patients with myeloma often have kidney involvement and kidney disease, and they're excluded from a lot of the pivotal trials, including the CAR-T trial. So this study particularly looked at patients with renal insufficiency with creatinine clearance less than 50 and over 50, and in a subgroup of creatinine clearance less than 30. And the study found that really outcomes were pretty comparable in patients with renal insufficiency and without renal insufficiency who underwent ide-cel, similar rates of CRS and neurotox. The one thing that they did note was that 1 month, any grade 3 or higher cytopenia was more common in those patients with renal insufficiency, and grade 3 neutropenia was also, and thrombocytopenia were also higher and statistically significant at that 1 month, but became lower at 90 days. So I think the study kind of highlighted that patients with renal insufficiency can have good efficacy outcomes with ide-cel, good safety outcomes with the exception of maybe higher rates of cytopenias at 1 month. And really, the study also evaluated risk factors for patients in terms of renal insufficiency outcomes and found that patients, who had high-risk disease, prior BCMA, age younger than 65 were independent adverse prognostic factors as we would expect, but renal insufficiency was not. So I think patients with renal insufficiency should be, be included in trials and this is a high-risk patient population of unmet need. And the study kind of highlights that really ide-cel can be safe and effective in these patients. So I think that's kind of the main, I would say, the abstracts. And there's a couple others as well, but that's kind of in the interest of time, I would say some of the highlights of the session.